Health is a fundamental human right, and there are very few people who would argue against that point. The US healthcare system, however, might argue against that point. If you look at the numbers of costs, we look at ambulances and insulin and the cost of giving birth and the cost of a regular doctor's checkup. You look at these things and you see how unaffordable it is to maintain your health. The US multi-payer system, despite having higher costs than any other insurance system of any other nation, leaves people underinsured and uninsured compared to those countries who have single payer systems or Medicare for all. In our current system, in the multi payer system, uninsured people and underinsured people both suffer from problems having such as a lower quality of life, being less likely to receive treatment for diseases, and higher mortality rates. And these are caused by a mix of lack of public appreciation, um, corporate greed, and government choices. But these things can be solved with an implementation of Medicare for all that will improve the quality of life for everyone in the country. According to the Journal of Community Psychology in March of 2020, results indicate that the number of chronic health conditions negatively impact that a number of chronic health conditions negatively impact the health related quality of life, and that people's agency is um, significantly related to that. That under and uninsured people in the US healthcare system don't believe that they'll ever get better. They see these costs and they see these things that are stopping them and they give up. They decide that, oh, I can't keep on living. Not like this, and not, there's no chance of improvement. And according to PLOS1 in February of 2022, we see that un and underinsured patients with cancer are less likely to receive chemo and have increased mortality rates. Simply put, people have the right to live and the right to be treated for their diseases. That no one should be discouraged by the cost of these things, the cost of treatment, the cost of care. So why are these problems such a big issue? According to the American Journal of Public Health, in June 2018, these issues are caused primarily by a lack of public appreciation of the fundamental health detriments in their individual and societal health um, products that they're receiving. There's no demand for people to create better healthcare because they don't know what they have and they don't know what they're missing out on. This is caused, this is due to a mix of government tactics, of ignorance, and of false beliefs that people don't believe that, or people believe that their taxes would then go up if they're paying for a different system versus what they are now, but the costs are negligible. According to Nations in December of 2020, they say that consolidation of government, of sorry, not of government, of hospital systems has left the U.S. with a healthcare system that's built on profit over care. The question that's one been asked by many a pharmaceutical company is why cure a disease when treating it is better for profit. According to the Preventing Chronic Disease Journal in July 2020, they said that several of the most rural states in the U.S. Opted not to expand Medicaid under the Affordable Care Act. 59% of underinsured people live in these states. We see that not only are businesses hurting the individuals who are uninsured, but the government itself is stepping in and opting not to give these people the care that they deserve on the grounds of political ideologies. Luckily, we can solve all these issues and their causes. Now, according to PLOS Medicine in January 2020, the single payer financing system leads to a favorable benefit system and lowers the financial burden. That efficiency savings will be greater than added costs, and the net cost reduction is expected to be initially 3 to 4%, and that number will just grow as time goes on and implementation becomes more effective and smoother. According to the Center for American Progress in January 2015, Medicare for all would guarantee universal coverage and would eliminate underinsurance. We would eliminate these people who don't believe that they can get better by providing access to treatment. And to show that this does work, we see in the drugs and alcohol review in March of 2019, in a study in Australia who had recently implemented this Medicare for All program, that when given access to Medicare, treatment uptake increased for a priority population. That in Australia, these priority people, the people who had chronic diseases, being given access to Medicare, went in and were treated and were helped immensely by this program. The quality of life improved, they got better, and they were eliminated their diseases stopped from spreading through the nation. I believe it was Hep C that they were talking about, but it works for all kinds of diseases that impact people negatively when they can't afford to get treated. We talked about the problems of people's quality of life being negative, people being less likely to receive treatment because of their insurance, them losing out on these rights because of their economic status. We've seen the causes of public appreciation, that people don't understand what's happening, and that big businesses and the state do what they think is effective, what's best, what's in their best interest, rather than what's in the individual's best interest. But if we were to implement this Medicare for all system, we would solve these issues. We would increase the quality of life for everyone in the nation. That the under and uninsured people would be able to become healthy, and that the people who are currently healthy would be able to become healthier at less cost and maintain that healthiness at less cost to themselves and at less cost to the nation as a whole. The U.S. multi-payer system as it currently stands is not effective in helping people receive treatment. It's not effective in helping people remain healthy. Health is a fundamental human right. Medicare for all would decrease individual and government expenses and improve the quality of life for everyone in the country. Why wouldn't we implement these?